friends, welcome back to my channel for my 20-week pregnancy update. So like I said, I'm 20 weeks pregnant this week, which means we are officially halfway there, and realistically probably over halfway there. My firstborn daughter was a month early, and even if this baby doesn't come quite so early, I'm fairly confident my doctor will not let me go over 38 weeks. So officially over halfway there, I guess. I talked a little bit more in my first trimester recap video about kind of the history of my pregnancies, the reason why this one is a high-risk pregnancy, and so if you missed that video, I'll have it linked down in the description box below so you can check that out and get up to date. As usual, I'm going to go through my symptoms today, as well as just some general updates on what's been going on and how things are going. I'll give a few updates on baby as well as my bump update. So first of all, symptoms. I talked in my last video about how things were going a lot more smoothly symptoms wise than my last pregnancy, and that is still true. Things are going very smoothly. I have a lot less nausea. Actually, I pretty much have no nausea except for like the odd time. Still have some food aversions, but those aren't very strong anymore. Even if there's something that I'm like not really feeling like eating, it's not causing me to feel sick. It's just kind of like, I don't really feel like eating that. I'm definitely starting to feel winded a lot more easily and kind of like tired out. If I'm, running around tidying up, I have to kind of sit down for a few minutes and rest in between. I am starting to feel some lower aches and pains sometimes, like that low pressure I talked about feeling last time, but it's still not to the severity as my first pregnancy, so things feel like a breeze to me this time. I'm still having quite a bit of insomnia. I find it's hit or miss. Either a night is like a really good night of sleep because I'm so tired, or I'm up all night just restless. I'm also having restless leg syndrome almost every night. So I'm just trying to stay hydrated in the day to kind of help with that symptom. I am still very tired. I don't really experience that burst of energy that supposedly comes with second trimester. I didn't experience that last time either. So I am still very fatigued. I am napping every day still. But like I said in my last update, I am thankful that I am home with my daughter and I can take naps and rest when I need to. Just some updates on baby. My app says that he is now the size of a banana, which is crazy. I should tell Mila that. She loves bananas. I am feeling a lot more movement these days, stronger kicks, and more frequently throughout the day. Before I was kind of only feeling some light kicks mostly at night, like around 9 o'clock kind of thing. But now I'm feeling it throughout the day as well. Mostly I find I feel movement if I lie on my back. So like if I'm trying to get the baby to kick, I'll just lie on my back, and like most of the time he starts kicking, which is, I'm not sure, kind of weird to me, but maybe there's a reason. Nick has felt the baby kick, and Mila has actually also felt the baby kick now. Just the other day, he was kicking during her bedtime routine, and so we stopped stories and she held her hand there and actually got to feel the baby kick once. Since then, she's asked me a couple of times, she'll say baby and point to my stomach and want to try to feel him kick, so that's been really cute to see her reaction. Moving on to just some general updates. I had my anatomy scan 2 weeks ago at 18 weeks, and it went very well. Everything that they saw looked good. They weren't able to see everything they needed to see with the heart. I don't think it was like a concerning thing at all. It was just that baby was in a breech position and they weren't able to see some things. So I am going back anyways in a week to get another ultrasound update, and they will check just to make sure that everything looks good there, but I'm not worried at all. It was just kind of, they weren't able to get all of the pictures that they were needing to see. One of the main questions I keep getting is whether or not I will be on bed rest again this time. Modified bed rest, I should say. I wasn't on full bed rest with my daughter, but I was basically restricted to go from bed to couch and limited movements in between. So far so good with that. My cervix is still measuring fairly long, so I haven't had to minimize my activity at all, which is good because we're in the middle of a move and packing, and I'm chasing a toddler around all day, so I was a little bit worried that I was gonna have to start limiting my movements already. But no, everything's looking good there so far. I am curious to see what it's measuring next week because it was at my 20-week appointment when they discovered that I had a short cervix last time, and I don't know if it had been shortening earlier or if it was right around that point that things really drastically started to shorten. So I'll be curious to see between last week and this week the difference. The other question that I've been getting, and it's a question of mine as well, is what I'm considering for birth plan. I did have a C-section with Mila because of some of the complications we had with a blood disorder. I was scheduled with Mila's pregnancy to have a procedure done to check her platelets at 38 weeks to see whether or not it was safe for me to have a vaginal birth or if it was safer for me to do a C-section with her. Because my water broke at 36 weeks, I was obviously not able to do that procedure. And so because they didn't know her platelet levels, it was just safer for me to go right into an emergency C-section at that time. Because I'm starting the treatments for that much earlier this time, there's a better chance that I won't start creating antibodies that are going to affect the baby negatively. So there is a chance that it will be safe for me to do a vaginal birth. Of course, they still have to consider the normal VBAC consideration. So I've been talking a little bit with my OB and her team already. They are starting to ask me some questions about what our plan is. I had a really positive C-section experience. I healed well. I didn't have any complications really. And so I don't mind the idea of having another C-section, but they have informed me that if we are wanting to have a lot more kids, then it might be smarter to try a VBAC this time. Basically, they said if I have a C-section this time, then I'm pretty much guaranteed to have a C-section in the future again. I also had a very interesting labor when my water broke with Mila. I was not feeling any contractions. I showed up at the hospital. I was 4 centimeters dilated, not in any pain, and I think within like 20 minutes I was dilated to 6 centimeters, still not feeling my contractions. I know I'm gonna get some hate for admitting all this, but that was just the experience that I was blessed with. So I'm kind of just curious to see how a vaginal delivery would go for me, to see at what point, you know, the strong contractions would kick in or like how that would go. So that is something we're considering for all those reasons. But obviously it's too early to tell if they would even approve me for a VBAC. So I'm not really banking on any one way of delivery at this point. I think part of why I had such a good C-section experience was because I kind of knew to expect a possible C-section. And so I didn't have any trauma associated with my birth plan not going as planned. I kind of knew that it was out of my hands to an extent. So that's kind of the way I'm treating it this time. The doctors will advise me and things will happen as they happen. And so I'm just going to kind of go with the flow with that for now. I mentioned that I will be getting those treatments earlier this time. And what they are is IVIG treatments. And I'm not like a science or medical person at all, so bear with me. But basically my understanding is that it's a blood infusion that helps to prevent me from creating the problematic antibodies that were affecting my baby's platelets. I might not be entirely correct on that, but that's my understanding. And so basically all I do is I go into the hospital and I sit there for a few hours getting an IV, and that's just the extent of the treatment. So it's not too bad. Last time I did experience some headaches and I was very fatigued, but I only had a couple of treatments last time before my water broke early. So this time I'll have a lot more treatments under my belt. So we'll see how that changes how I'm affected by them, I guess. Another question we've been getting is whether or not we've picked a name yet. We have obviously started talking about names. We have a boy name that we had basically picked out for if Mila had ended up being a boy, and we were pretty set on it at the time. So that's a strong contender right now. We are kind of considering some other names as well, just because I want to give it like a fair process of like looking through names this time for this baby. If we do continue to be drawn back to that first option, then of course that'll be the name we go with. But we're still looking around, taking suggestions. So if you have any name ideas, drop them in the comments for me down below. I think that's pretty much all of the general stuff that's been going on the last 5 weeks. So now I'll just show you my bump progress. I definitely feel more pregnant now. I feel like my bump is getting bigger. I'm starting to feel that little bit of stretch, even though we have a long way to go. I'm also like sick of maternity clothes this time, which is kind of weird. Last time I was like really drawn to the actual maternity wear, but this time I'm feeling very like claustrophobic in that stuff, and I just want to be wearing regular clothes that are maybe like a size up to fit my bump. So I may look into getting a couple of fresh maternity friendly clothes just to kind of feel a little bit more refreshed and kind of get out of that rut of feeling like blah and like I'm in sweatpants and leggings all the time. Because I am. Well, that does it for my 20-week update. I think that's everything I wanted to chat about, although my baby brain is very real right now. So if there's anything else I've missed, then feel free to leave me any questions down in the comments. I'm always happy to chat with you guys in there. And give this video a thumbs up if you enjoyed it. I hope if this is your first time stopping by that you enjoyed this video, and I hope you'll consider subscribing to my channel so you don't miss any future pregnancy videos and pregnancy updates. Thanks so much for watching. I'll see you guys in the next video.